How does inflammation contribute to mental health issues? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist and a metabolic psychiatrist, which means that I look at the overlap between mental health and metabolic health. And one of the things I talk about on this app, as I'm sure many others do as well, is the role that chronic inflammation can have on causing or exacerbating mental health symptoms. So let's talk about exactly how this works. First, let's talk about what causes chronic inflammation. So there can be a lot of potential causes, but some include autoimmune disorders, if there's a chronic infection or an injury, or if there's exposure to environmental toxins. This could be things like air pollution, heavy metals, secondhand smoke. And of course, there are significant lifestyle factors. So things like eating a diet that is high in processed sugars and carbohydrates and unhealthy fats, living a sedentary lifestyle, using tobacco, alcohol, and other substances. And of course, just life stressors, whether they're chronic or acute. There are also certain medications that can contribute to inflammation. So things like certain antibiotics, steroids, and even for some people, statins. Okay, so you have inflammation. How does that cause mental health symptoms? Well, there's a few different mechanisms. One is that chronic inflammation causes a leaky blood-brain barrier. So this means that potentially toxic or harmful substances that would not normally be able to get into the brain are able to get in there. And of course, these can act on the mitochondria and impair cellular metabolism. Inflammation can also interfere with the normal production and function of neurotransmitters, which, as we all know, are really important for our mental health. Inflammation can also affect brain circuits and the communication of one area of the brain to another. So when certain brain areas like the amygdala, which is in charge of our fear response, or the hypothalamus, which is in charge of our memory, are not receiving the correct signal, this can lead to mental health symptoms. So when these things occur, we're going to get mental health symptoms like anxiety, depression, brain fog, memory issues, and even psychotic symptoms in some cases. So how do we reverse it? Well, we're going to look at those root causes of the inflammation and try to eliminate that, whether it's improving the quality of your diet, making sure that you're getting enough sleep, working on stress management, eliminating toxins, treating an infection, letting a wound heal, or maybe stopping certain medications. I know this is a lot to conceptualize, but I hope it was a little bit helpful. If you have any questions about what was discussed here, or maybe you've had an experience with eliminating or reducing inflammation and that's had an effect on your mental health, I'd love to hear about it. Please put it in the comments below. Wishing you all good mental health today, and I'll see you in the next one.